It can be quite embarrassing to have bad breath. Also known as halitosis, bad breath is mostly the result of poor dental hygiene and sometimes your diet. It is to no surprise that grocery stores and pharmacies are filled with mouthwashes, gums, and other products that can fight or reduce bad breath. Under usual circumstances, bad breath can be treated by following a proper dental hygiene like brushing your teeth twice a day, regular flossing, regularly visiting dentist, and dental cleanups. However, if you still don't get relief from bad breath, then it may not be something to do with your oral health, but because of your diet. Lesser known causes of bad breath. Number 1. High sulfur foods. Foods like garlic, onion, and even egg yolk are high sulfur foods which can contribute to bad breath and even foul smelling sweat. Eliminating these foods from your diet can help you get rid of bad breath. Number 2. Ketosis. When you follow the ketogenic diet, the body uses protein or fat as a source of energy. Keto diet or Atkins diet are known to have side effects like bad breath. Number 3. Dry mouth. In this condition, there's less saliva in the mouth. Because of this, there's less circulation of the fluids, which helps in cleaning out food from your mouth. It also results in bacteria to stay in the mouth, which may cause bad breath. Presence of saliva ensures a healthy environment in your oral cavity. Dehydration, excessive intake of caffeine, alcohol, etc. can result in dry mouth or less saliva in mouth. Number 4. Smoking. People who smoke too frequently or smoke too many cigarettes in a day have bad breath. Smoking is also harmful for your oral health and hygiene. Number 5. Certain medicines. There are certain drugs that can cause dry mouth and result in bad breath. Antidepressants, diuretics, and antihistamines can give side effects like bad breath. Number 6. Pregnancy. Hormonal fluctuations during pregnancy may lead to bad breath. Also, water requirement of the body increases during pregnancy, and this may be the reason why some women may have bad breath during pregnancy. And finally, number 7. Poor gum health. Accumulation of plaque in teeth can lead to gingivitis or inflammation of the gums and may lead to bad breath. Following a balanced diet with all food groups, especially rich in vitamin C, drinking sufficient water, and avoiding long gaps between meals can be effective ways to prevent bad breath.